Waking up to urinate in the middle of the night might seem like a minor annoyance, but it's often a sign of something far more concerning. Nocturia, the medical term for frequent nighttime urination, isn't just a sleep disruptor. It's a red flag that your body is struggling with something deeper. Too many people dismiss it as a natural part of aging, but that mindset can be dangerous. If you're regularly waking up to pee, it could be a sign of an undiagnosed health condition, an issue with your medications, or a disruption in your body's hormonal balance. And if you're ignoring it, you're not just losing sleep. You could be putting your health at serious risk. At first, it's easy to blame simple factors like drinking too much water before bed. While excessive fluid intake in the evening can certainly contribute, the truth is far more complicated. Caffeinated drinks, alcohol, and even so-called relaxing teas can act as diuretics, increasing urine production and making nighttime awakenings more likely. Even your diet plays a role. Water-heavy foods like watermelon, cucumbers, and oranges can overload your system before bed, forcing you into unnecessary bathroom trips. But if you've cut back on these triggers and still find yourself waking up, something more dangerous could be at play. Hormonal shifts are another major cause, and they're not something you can control. As you age, your body naturally produces less antidiuretic hormone, ADH, which helps retain water overnight. Without enough ADH, your kidneys keep producing urine even when you're asleep, leading to frequent awakenings. In women, declining estrogen levels after menopause weaken the bladder and pelvic muscles, making nocturia worse. For men, prostate enlargement due to aging can create urinary urgency and incomplete bladder emptying, which means multiple trips to the bathroom during the night. These changes happen gradually, which is why many people don't notice them until their sleep is significantly impacted. But the real danger of nocturia lies in the conditions it could be masking. High blood pressure, diabetes, and even heart disease can all present as frequent nighttime urination. Elevated blood sugar levels force the body to expel excess glucose through urine, while fluctuating blood pressure can put extra strain on your kidneys, increasing urine production. And perhaps most concerning of all, nocturia is strongly linked to sleep apnea, a condition in which your breathing repeatedly stops and starts throughout the night. Many people assume they're waking up to pee, but in reality, their body is gasping for air. The interrupted sleep cycle increases urine production, creating a vicious cycle that only worsens over time. Medications can also be a major culprit. Diuretics, commonly prescribed for high blood pressure, actively increase urine output and can be particularly disruptive if taken later in the day. Antidepressants, muscle relaxants, and even diabetes medications can interfere with bladder function, making nighttime urination even worse. If your doctor hasn't warned you about these side effects, you could be suffering needlessly. Worse, if you're taking multiple medications that impact fluid balance, you might be facing an even greater risk. Even if medical conditions or medications aren't to blame, there's another troubling factor at play: aging itself. As you get older, your sleep becomes lighter, making it easier to wake up for any minor disturbance, including a slight urge to urinate. But the problem is, once you wake up, it's often difficult to fall back asleep. Many people find themselves scrolling through their phones, thinking about work or stressing about life, making their sleep quality even worse. This fragmented sleep pattern can lead to long-term health issues, from increased stress and weight gain to a higher risk of cognitive decline. The consequences of untreated nocturia go beyond just exhaustion. Chronic sleep disruption weakens the immune system, raises the risk of depression, and can even shorten your lifespan. If you're waking up every night to use the bathroom, you're not just losing rest, you're damaging your body in ways that can have lasting consequences. The frustrating part is that many people don't take it seriously. They assume it's just part of getting older, not realizing that their body is sending them a warning. Ignoring nocturia is a mistake. If lifestyle changes like reducing fluid intake before bed don't help, it's critical to get to the root of the problem. Hormonal imbalances, prostate issues, cardiovascular conditions, and even undiagnosed sleep apnea could all be contributing factors. And if left unchecked, these conditions will only get worse. The next time you find yourself shuffling to the bathroom at 2 a.m., don't just brush it off. Listen to what your body is telling you. Your health might depend on it.